A brain stroke is a serious medical emergency that happens when blood flow to part of the brain is blocked or when a blood vessel in the brain bursts and causes bleeding. There are two main types of stroke: ischemic stroke, which occurs when a blood clot or blockage prevents blood from reaching part of the brain, and hemorrhagic stroke, which occurs when a blood vessel ruptures and bleeds into or around the brain. Some important risk factors include high blood pressure, diabetes, high cholesterol, smoking, obesity, physical inactivity, unhealthy diet, certain heart conditions, and increasing age. High blood pressure is particularly important because it can damage blood vessels over time and increase the risk of both blockage and bleeding. One of the most important things everyone should know is how to recognize the warning signs of stroke. A simple way to remember them is FAST. F means face. One side of the face may suddenly become weak or droop when the person smiles. A means arms. One arm may suddenly become weak or droop when the person smiles, or may drift downward when both arms are raised. S means speech. The person's speech may suddenly become slurred, confused, or difficult to understand. T means time. If any of these symptoms suddenly appear, emergency medical help should be sought immediately. Other possible symptoms include sudden numbness or weakness, especially on one side of the body, sudden difficulty seeing, dizziness or loss of balance, confusion, difficulty understanding, or a sudden severe headache with no known cause. Do not wait to see if the symptoms disappear. Treatment depends on the type of stroke. Doctors usually perform urgent brain imaging to determine whether the stroke is caused by a blood clot or bleeding. For some people with an ischemic stroke, doctors may use clot-dissolving medicine if the patient reaches medical care within the appropriate treatment window and meets the medical criteria. Some patients with certain large blood vessel blockages may also be treated with mechanical thrombectomy, a procedure that removes the clot from the blood vessel. Hemorrhagic stroke requires a different approach. This is why people should never self-treat a suspected stroke with aspirin or blood-thinning medication, because the treatment depends on the type of stroke. After the emergency phase, many stroke survivors need rehabilitation. Depending on the part of the brain affected, a person may have difficulty walking, moving an arm, speaking, swallowing, remembering information, or performing everyday activities. Physiotherapy, occupational therapy, speech and language therapy, and other rehabilitation services can help many people regain function and independence. Recovery is different for every individual and may take weeks, months, or longer. The good news is that many stroke risk factors can be reduced. Regularly check and control blood pressure, blood sugar, and cholesterol. Avoid smoking